The United Kingdom invented public health legislation in the Victorian era, but has struggled to run an effective test and trace system against coronavirus. We'll look at the experience of all 4 home nations and contrast that with the tiny Faroe Islands, where they've beaten COVID not once, but twice. Join us on the Alex Salmond Show, on air and online.
Welcome to the Alex Salmond Show, where we examine the performance of COVID-19 test and trace systems across the UK and compare it with the plan used in the tiny Faroe Islands. 6 months into the pandemic, and criticism is still widespread on the failings of test and trace. There have been many false dawns. Back in March, Prime Minister Boris Johnson hailed a COVID antibody test as a game changer in the battle against the deadly virus. Millions of tests were purchased and subsequently found to be totally useless. Even now, approved antibody tests are not available to the general population unless they buy their own or go private. Yet another game changer in the testing regime was to be the contact tracing app launched by English Health Secretary Matt Hancock amid great fanfare as a trial in the Isle of Wight in May. It was subsequently abandoned in June, and now a new app has been launched on the same island and in the London borough of Newham. And criticism still continues on the results of the present manual system in England, with The Guardian reporting last week that the tracing results were being hit by delays and home test failures. Meanwhile, the Scottish press last week was full of stories of anxious people seeking a local test and instead being referred to testing centres in England or Northern Ireland. So why is it that in the UK, the country which pioneered community health protection from infectious diseases in the 19th century, it has been so difficult to operate it effectively in the 21st. Today we ask health expert Dr. Pankhania what on earth has been going on. Then we turn in contrast to an example of effective test and trace, not in the Far East or Asia, but off our northern shores, where the tiny Faroe Islands have conquered COVID once and are now well on their way to doing it again. And so what lessons can be learned from our tiny island neighbours? All that later in the show, but first over to Alex with your tweets, messages and emails on last week's show on the end of the American era.
Well, lots and lots of comments this week on the Wade Davis interview, and that was about his article in the Rolling Stone magazine, an article that went viral. But the first comment I've got is from Ravuf, who's watching from Cambodia, who says, "Thanks for the great show." Well, thanks for writing in, Ravuf. And then Jeff White says about the Wade Davis article, "I read the article and it's spot on." And Louise Hogg sends an interesting comment about the end of the American era, which was the argument that Wade Davis was putting forward. She says, as regards the USA, it's logical to assume that China will return to its historical dominance soon. Whether bad, the genocide of the Uyghurs, no democracy, persecution of Christians, massive environmental humanitarian disasters over the years, expansionism, or good, keeping an astonishingly huge population and rising living standards, a high level of peaceful law and order, a vast capability to address health, energy and environmental issues efficiently, who knows, says Louise, where all that will lead. And Jacqueline says, unemployment will overtake COVID as a killer. Rainey says, a good interview, allowing comments and opinions to be expressed. And Yvonne, writing from the comfort of her Kenyan house, appreciates the global issues that are tackled in the show. John Thorburn says, they, speaking about America, don't deserve to be leaders of the free world. They gave up that right years ago. Ian English says, America's imploding. Trump was the beginning of the end for them. And Patricia says, not just America, the whole world will never be the same again. This is just the beginning. It's sad. But Heather Strang takes exactly the opposite point of view. She sticks up for the American president. Don't be on the wrong side of history. Trump has made every politician look like incompetent idiots. He created 3 million jobs in June in the middle of the pandemic. Well, thanks, Heather. It's always good to get a contrary point of view. Now back to Tasmina.
Dr. Bharat Pankhania of Exeter Medical School has over 20 years' experience in infectious disease control. He worked as a consultant in communicable disease control for local authorities and Public Health England, the agency which is now being blamed by UK government ministers for the failures of test and trace. He is in conversation with Alex.
Dr. Pankhania, you have huge experience in infectious disease control. Can you tell me why is it that in the United Kingdom, the country which 180 years ago pioneered public health legislation, that all 4 home nations are finding it so difficult to get a grip on coronavirus?
I think this is an example of how low we have sunk with regards to both our National Health Service and our investment in public health. I mean, I am one of those persons who has been in public health for over 20 years, and gradually, slowly, drip by drip, we have either made redundant experts, we have disinvested in it, we sent most of public health to local authorities, and then the local authorities reduced their numbers further over there. And in the creation from Health Protection Agency, which was a very good idea, to Public Health England, we have diluted our strength and energies. And this is the price we are paying today. It is very, very lamentable, very unfortunate.
Now let's look at the English experience first. Ministers seem to be blaming Public Health England. They say they're going to scrap that organisation. Is that a fair criticism?
No, I disagree. I disagree. And in the middle of a pandemic, to cancel the very organisation that the Secretary of State for Health is in charge of asks me to ask the question, if Public Health England isn't fit for purpose, the head of the Public Health England eventually is the Secretary of State for Health and Social Care too. So, those are the questions to ask also. Furthermore, this is the very painful bit. When the pandemic started, of course, we could not do the test and trace because we were under-resourced and we didn't have the capability to do it. But we went ahead and invested a staggering amount in testing and contact tracing by private suppliers. If that same money had been allocated to Public Health England and told, do it, get on with it, create the system nationwide, I think it would have been done, and it would have been done well. For some reason, since March, Public Health England was bypassed.
Yeah, you're right in saying that the testing was slow to get started. They were slow in getting the capability, but there's plenty of testing in the UK going on now relative to other countries. So why is there still a problem when there's the capability of testing? I mean, is it the tracing end of the system that's failing now?
There's failures across all facets, unfortunately, and it is so painful to note because United Kingdom is an advanced country. It has a lot of clever people in place. And considering we have the armaments, we have the clever people, we have the logistics, we have everything in place, we go ahead and invent a centralized system from the beginning. When actually what we could have done, we can do, we should be doing is enabling local testing, local laboratories energized to set up the testing, and we take the test and we do it locally, we process it locally, and we communicate the results locally because we're already set up to communicate these results. Here is one ridiculous item about it. We set up a new testing regime and contact tracing one as well, and they can't communicate easily, seamlessly with our GPs and patients and others. Therefore, even the test results, eventually when they're conducted, are not communicated to the people that matter. And we had the systems. So why not use the systems instead of create one in the middle of a pandemic?
So how important is local knowledge and local delivery in running an effective test and tracing regime?
Absolutely crucial. It won't work otherwise. And I have been banging on about this forever since it was created, that you need central assistance, central support, but locally delivered. All of them are networked with each other, and they know the lie of the land, and they work on these things every day on other illnesses and other outbreaks. And then suddenly, for the biggest pandemic that we've seen, they're not intimately involved. It's ridiculous.
Now, obviously, this is a condition of which there is no cure at the present moment. But we've had conditions like that in the past. There have been diseases which there were no cure for, and we had public health prevention methods. I mean, how could that whole body of knowledge and understanding be lost?
It is not lost, it's just that we are not using it properly. We've got experts locally, nationally, and international experts in our country. And for whatever reason, which is hard to understand and explain, there has been a narrow focus from the experts advising the government. The experts advising the government, if you look at their makeup, a lot of them were modelers and scientists, social scientists, but very few, very, very few, if any, were hands-on outbreak specialists. I didn't see the name of anyone who has actually hands-on done an outbreak of any size locally of national interest. No one. They will all claim we have been involved in outbreaks. My question is, how many of you have actually led on, say, a large E. coli outbreak, a large Salmonella outbreak, or any of that in the last few years? No one.
Now, in the past, diseases like tuberculosis or smallpox, how was that done then? I mean, were there delivery kits or things like that? And how was test and tracing done in these great communicable diseases of the past?
So with respect to tuberculosis, we still do the tried and trusted identify the patient, get to know the patient well, get underneath the skin of the patient, as I tell my students. You've got to understand your patient. Having understood your patient, you then unearth from them who their contacts are. Where do they drink? Who do they socialize with? Where do they work? Who do they go out with? Their social network. In other words, you're almost befriending the patient. And then you send out your army of colleagues to pull in all those contacts of that case. And you can do that rapidly if you know the lie of the land. And the same applies, which we used to do when smallpox was here. We used to test and we used to trace. And when we were floundering and there was something very complicated, I remember myself calling my senior colleagues in Colindale and saying, this is a little bit complicated. Can we have a discussion? And somehow we've let go of all that expertise that we've always had.
Now, we're told that a new app might be the magic bullet that helps. So how do you rate these apps? The one that was tried out in Isle of Wight, a new one which is also being tried out in Isle of Wight and elsewhere. How do you rate them as a tool, and could they save the day?
Not on their own, no way. They are an additional aid to contact tracing. They are not on their own the magic bullet that we are led to believe. So you really need that local input as well as that application if and when it works. Now, with respect to the application, again, I remember saying it clearly that a centralized application will have low uptake and people will not adhere to wanting that application because you're collecting too much personal data centrally. And Google plus Apple, for the first time ever, joined up to create a decentralized application. And I, again, am baffled. Why don't we just use something that world experts have developed? Why go around developing your own when you could use what Ireland has got? They've got a very good application also running. Why are we insisting on making our own?
Now, Dr. Pankhania, would you say it is actually possible to contain this virus while there's nightlife and pubs are open? Many people are arguing that these two things are incompatible. You can't, on one hand, contain a virus and, on the other hand, provide a setting where a virus will clearly thrive and be hyper-infectious.
The two are not compatible. It's as simple as that. We are kidding ourselves by saying, on the one hand, open up the pubs, the restaurants, the businesses, and life as normal. And on the other hand, we've got a virus in circulation. If we had adopted the New Zealand style approach of we wish to eliminate it hard and fast and early as soon as it appeared, we would be in a better position. Similarly, we've had smaller countries, tiny countries like the Faroe Islands. So they also have a zero COVID policy, which is we don't want to live with any cases. And New Zealand adopted the same way. So in answer to your question, The two are not compatible. What we have to do is aim for, we wish to eliminate it from Ireland, Britain. And if you are going to eliminate it, there will be some tough things to do. And once you've done it, you have to contain it. But if you carry on, with business as normal, open up the pubs and continue with interactions with fellow human beings, then I'm afraid it is not possible to also say we are in control of it.
Join us after the break where I'll continue this discussion with Dr. Pankhania of Exeter University, and we'll look in detail at these international examples.
Welcome back. Alex is in conversation with Dr. Bharat Pankhania about the problems being experienced with operating an effective test and tracing system on COVID across the UK.
Dr. Pankhania, let's look in detail at these international examples. I mean, why have some countries been able to deliver and some countries have struggled?
The countries that took early decisive actions have done a great job. Let's start with South Korea. So when things happened in China and then cases started to appear in South Korea, they unleashed an army, a huge army of testers and contact tracers. And they had the compliance of the population, they had the will of the government, and they had the armaments ready, i.e. the testers and the contact tracers. And if you look at the graph, it is amazing how they just managed to flatten it quickly. Another example, poorer countries, Vietnam, Taiwan, did similar things and they brought things under control. New Zealand is a marvelous example of where they took early decisive actions in saying, we will aim for zero COVID in our country. So they drew a net around the country and they suppressed the case numbers hard and fast and early, and they've got a result. The United Kingdom gave up. The truth is, we gave up sometime in March to say containment is no longer possible. And now in September, we are still trying to contain it. So we gave up really. And even Germany did a wonderful job in Europe. They had a good policy of testing, contact tracing, and better still, they were monitoring their patients at home. And when they found that their patients were, shall we say, showing more signs of illness, they took them out to hospital early. And as a result of taking their patients to hospital early, they had a much lower death rate. Of course, they didn't make the huge mistake of also introducing infections into nursing and residential homes, which we did in the United Kingdom.
Dr. Pankhania, a final question. Let's say I had the power to appoint you as the new Secretary of State for Health, and I'd be strongly tempted to do so. But let's say I had that power and you were the new broom which was coming in to sweep clean. What would be your first series of action to get this virus and infection under control?
I would bring together all my local networks. We already have existing experts locally, and I would want to invest in my new Public Health England rather than create new systems.
Dr. Pankhania of Exeter University, thank you so much for joining me on the Alex Salmond Show.
Thank you.
So problems still abound across the UK, and the contrast is often drawn with more effective systems of disease control in Asia. However, much closer to home, there is an example of a tiny country which has tackled the community transmission of COVID-19 not once, but twice. Alex is joined by two of the people instrumental in this success story, Kristina Háfoss MP and Christiansen, Head of Department and Researcher at the Faroese Food and Veterinary Authority.
Kristina Háfoss and Dr. Christiansen, welcome to the Alex Salmond Show.
Thank you very much. Good to be here.
Kristina, when we last spoke in this programme, the Faroes had established a virus-free status. You'd got a hold of the few cases you had and you'd managed to clamp down. But since then, there have been some clusters have re-emerged in the Faroe Islands. How have you dealt with these?
Yes, the Faroe Islands were among the first nations in the world to become COVID-19 free. And we didn't have a positive case for more than 3 months, actually. But unfortunately, here in August, we had a new outbreak. and it has been quite a big outbreak, but we have handled it by using the tool that we also used back in March with mass testing, tracing, and quarantining people. So at the moment, it seems like we have gotten the situation under control.
Dr. Christiansen, you're the man who suggested to the Faroese authorities, let's use the Salmon Laboratories to give us the testing capacity to test a substantial part of our population. Were you confident that that facility would work for this new virus?
Yes, our laboratory was established 20 years ago, and that's mainly in salmon farming industry to track viral diseases in Atlantic salmon. And for our laboratory, it doesn't matter if the sample comes, if the swab sample comes from the gills of a salmon or if it comes from the throat of a person. The methodology is pretty much the same in our hands. The only thing that we have to change between if it's a salmon virus or a human virus is some specific ingredients that we can switch between those different assays.
So that's like using the natural resources of the Faroes to deploy to protect the human population. That would give you a capacity to test a huge proportion of the relatively small Faroese population.
Yeah, at the moment we are our institute and another private company that are doing the testing, and actually we can do up to 4 to 5% of the population a day if we work 24 hours a day. So we have a fairly good capacity at the moment. So we can test a high proportion of the Faroese population, and that's also one of the success that we have been able to combat this outbreak so fast and efficiently. It's not over yet because there are still positives out there, but they are dropped down very fast during the last couple of days, the last week.
Kristina Háfoss, getting people tested is only one part of the story. You've then got to contain the renewed clusters. What's the Faroese approach been to tracing and to isolation of the potential contacts?
Yes, you're right, Alex. Testing is one thing, but tracing is just as important if you want to stop an outbreak. So all the people who have tested positive have had you can say interviews with our health authorities, and together they have found out where have they been the last couple of days, which people could they have been in contact with, and then the authorities have contacted all the people who have been in contact with people who tested positive and put them into 2 weeks quarantine, because even though people may test negative, after a few days they may test positive. So tracing people who have been in contact with people who are infected and putting them into 2 weeks quarantine is vital. And I could add that the last couple of days, most of the new cases have been people that already were in quarantine. So this just tells us how important it is, not just to test, but also to trace and to put people into quarantine if you really want to stop an outbreak.
And what have you learned, Kristina Háfoss, about how the infection got back into the Faroes? After eliminating it in the early part of the year, how did these clusters re-emerge? Was it tourism or the fishing community? How did they get back into the islands?
We knew that when we chose to reopen our borders back in mid-June, that it was a risk. But we chose to test all travelers who have arrived in the Faroe Islands, and that has protected us until August. It seems that one traveler has tested negative at the airport, but still has been positive after a couple of days. And unfortunately, that person has been able to infect others.
Looking at the Faroes' experience over this year, what does a small country like the Faroes have to teach larger countries who have struggled much, much more with the virus than you have? What about your experience could be applied to the larger countries of the world?
I think that you have to act locally, and you have to give the local communities the necessary tools to find the solutions that fit to those areas. And for example, in Scotland, it would be very good if the islands could have their strategies, both when it comes to acting on if there is a new outbreak, but also when it comes to reopening the islands, because things can be so very different from, for example, Edinburgh to the Shetland Islands. What is the right thing to do? For us, it has been vital to have our own strategy and have our own tools, also our laboratories, our skilled staff, and to be able to act. Because if we were to act in the same way as, for example, Denmark, or if we had to send all our testing material to abroad, it would take days before we got the results, and we would not be able to contain the virus like we have done. So it's important that you can have a strategy that fits locally, definitely.
So the message from the Faroes is act locally to confront a global danger. Kristina, Háfoss, Dr. Christiansen, thank you so much for joining me on the Alex Salmon Show.
You're welcome.
Thank you.
At least in the Western world, the United Kingdom is the home of public health legislation. To meet the challenges of infectious disease in the overcrowded cities of the Industrial Revolution, the first public health legislation was passed in the 1840s to tackle the deadly conditions of cholera, yellow fever and tuberculosis. These early campaigners realised that prevention was necessary where there was no cure, and the Public Health Act was passed by the Liberal government of Lord John Russell. Where there was a cure for various deadly conditions like smallpox, vaccination was made compulsory in 1851. With that heritage in public health second to none, and with still largely integrated health services, it is astonishing that the UK has not better prepared to meet the admittedly tough challenges of coronavirus and the control of the COVID disease. Scotland, Wales and Ireland have fared somewhat better than England, but not by much. The reality is all of the home nations have struggled. The tiny Faroes gives us a clue as to why effective public health systems have always been delivered locally, and that key community knowledge is the secret to stamping out the embers of any clusters. If the Faroe system had been run from Copenhagen, Denmark, it would not have been effective. The move to centralisation of public health organisation across the UK thus may not have helped in the development of a rapid response to coronavirus. In infectious disease control, local information and the speed of response which comes with it is more valuable than that provided by any app, however useful a functioning online tool would be. Perhaps in public health, the key to success is to act local to face down a global challenge. But for now, from Alex, myself and all at the show, it's goodbye, stay safe, and we hope to see you all again next week.